So this is an important update to a story I have covered earlier. So today, August 21st, the nurses at Kaiser Permanente's Zafarvial facility are hitting the streets in protest. They're fighting back against the planned layoff of 41 to 42 outpatient nurses. So let's be clear, this is happening despite the fact that Kaiser pulled in $13 billion in net income in 2024. So yet, instead of reinvesting that money into staffing and patient care and community health, they're slashing jobs. The California Nurses Association is leading the charge, calling out Kaiser's decision as not just financially unnecessary, but morally irresponsible. These nurses are sounding the alarm, not just for their jobs, but for patient safety. Fewer nurses means longer wait times, worse outcomes, and more burnout for the ones who stay. So this isn't just about the one hospital. If Kaiser gets away with this here, it sets a dangerous precedent across California and beyond. So today's rally is more than just a protest. It's a fight for the future of nursing and for patients who deserve better than corporate cost cutting at the expense of care. If you stand with nurses, share this. Tag your reps and don't let this get buried. We are all watching, we're remembering, and we will not back down.
Nurses are striking all over the country, and this is for good reason. Despite record profits, the company Kaiser Permanente has been doing layoffs, a lot of budget cuts, and basically, as with a lot of healthcare companies, we think they are getting greedy. So a lot of these nurses are coming together, they're unionizing, they are striking, they want better benefits, better pay, they want the layoffs to stop. This is treating our nurses very poorly, and it needs to have some change because these are the people that are caring for patients. Healthcare is very important. It's the number one priority in the United States at the moment, and patients need the care they deserve. But in order to do that, it starts with the nurses, the ones actually taking care of people. Let me know down in the comments and take a look at the rest of these clips.
Kaiser Permanente made $13 billion in profit last year. So why are they laying off 42 nurses in Northern California? I received a tip from someone on the inside, and after reviewing internal documents, I can definitely confirm Kaiser is moving forward with layoffs at its San Rafael and Petaluma outpatient clinics. So that includes 8 GI nurses who provided sedation during colonoscopies, procedures that literally save lives. These nurses don't just assist, they monitor your vitals, keep you safe during sedation, and respond if anything goes wrong. Without them, patient safety is at risk. Right now, patients are already waiting weeks for colonoscopy appointments. And if these nurses are let go, that backlog is just only going to get worse. So all this while Kaiser reported a record $12.9 billion with a B profit in just last year and another $2 billion in just the first quarter of 2025. The California Nurses Association is demanding that these layoffs be stopped. They say Kaiser is outsourcing care and investing in AI and telehealth while shortchanging the real nurses who care for patients face to face. So layoffs like this aren't about survival. They're definitely about priorities. And when profit comes before people, patients suffer. So let's be clear. Kaiser can't afford safe staffing. Patients deserve better. Nurses deserve better.
I'm a cancer survivor, and I just had to wait 6 weeks for a colonoscopy at San Francisco Kaiser, and it wasn't the results that I was hoping for. I got one of the layoff notices on July 17th, the same day I was having my colonoscopy. These are things that are happening to me, and I'm a patient as well as a nurse, and it's got to be stopped.
Hands up for patient care! Hands up for patient care!
We are fighting for no layoffs for 42 nurses with Kaiser between Petaluma and San Rafael, and I got a layoff notice last Friday, and it basically says you have 60 days. After working for Kaiser for 27 years, I am angry, I am upset. I have to take care of my family, so I'm like, I cannot believe they're laying off nurses just like that.
Kaiser made $12.9
billion. It's a record profit for them in 2024, and they are already on track to do the same this year. I don't know how a multi-billion-dollar healthcare corporation thinks that laying off a third of their nursing staff in the outpatient clinics is in the best interest of patient care. Maria Ansari has this vision that virtual medicine is the way to go, but virtual medicine can't listen for fetal heart tones. Virtual medicine can't do wound care. Virtual medicine can't assist in an OR for a colonoscopy.
This is just not acceptable. It will increase the danger and unsafetyness of delivering patient care in the outpatient area. Premiums are getting more and more expensive, and yet the care is getting more and more diluted. It should be single payer. There should be more organizing of people to be union members. It should be everybody elevating each other to be able to unapologetically advocate for our patients and our communities together. This is a very unique moment, and everybody needs to wake up and everybody needs to speak up, and there's power in numbers, and we all need to be in solidarity to continue to fight for our rights and change the dialogue.
So I decided not to sue Kaiser. But today I got a denial letter from them, and I'm reconsidering my entire decision. Kaiser, Dr. Kim from Central Valley, California. I decided not to, right? I was under her care for 14 years. Original diagnosis under someone else, Sutter. Then treated under Kim for 14 years. As a child, mind that. As a child, right? My condition, my Caesar condition, never controlled. Always just heavily more medicated. Oh, it's not working? Okay, labs, up in medication, labs, up in medication, labs, up in medication. Then I got to the point where I was having hundreds of seizures a day. And I finally built up the courage for this doctor who was so negligent for 14 years because her damn ego was so big to think that she couldn't make a mistake, right? Couldn't make a wrong call, miss something. And I finally built up the courage and said, can I please see someone else who has a different opinion? Because I don't think I have what you think I have. She said, you know what? I think you're right. That was her response. I think you're right. I'll send you to an epidemiologist. Why was this option never presented for another 14 years? It's never been under control. Whatever, that's fine. Okay, send me there. Within an hour of speaking to me, the epidemiologist said, you're misdiagnosed. They missed a condition. Here it is. An hour of speaking to me. Not reviewing any of my charts, not reviewing any of that, just having a conversation. A year later, under a different treatment, it's under relatively good control. Not complete, and I will be in treatment for the rest of my life because of the damage that the medication did to me. The damage the medication I was wrongfully on did to me. Now, after all that was 3 years ago, I received my misdiagnosis that we finally realized everything's wrong. I've been in heavy treatment to get off all the medications that I was addicted to, went through all those crazy symptoms and now I'm on the other side, and that's okay. And I have one bill, right? It's like $1,000 bill. Not even, $1,000 is a lot, but not crazy amount, right? And I submitted it to Kaiser and said, hey, I want you guys to cover this. This was your mistake. $1,000. I did nothing else. I didn't go to anyone. I didn't say anything. I've never mentioned Kaiser or the doctor publicly ever, right? I turned around and wrote a book and mentioned no names to get out all of my trauma because I'm just not a sue happy person. You're denying $1,000 and no, in this letter right here, saying they did everything they could. Really? Okay, now I want a written statement from your doctor saying she did everything she could for 14 years and made no mistake. That's what I want, Kaiser.
What up, Nurse Gang? What up, TikTok? So today on Nurses in the News, Kaiser Permanente, the healthcare giant, is laying off nurses in California. Yes, Kaiser sent out 42 layoff notices to nurses working in outpatient clinics, mainly GI, OB, and mental health at San Rafael and Petaluma. They are giving the nurses 60 days. They're saying that they have about 400 open positions across the health system in California, and the nurses have time to transition into another job within their healthcare system if they want to stay with Kaiser Permanente. They said they have to make these cuts. They just do not have the funding. What are your thoughts? Let's talk about it.
Well, today is officially my last day working in healthcare. Most people who know me personally know that I am an OB sonographer. I went to school, got my degree, and I was working at a clinic that only scanned pregnant women, and that was a great job. I loved it, but it wasn't sustainable for me. I mean, that job in itself, that is a story for another day, but if you are interested, comment below and I can tell that story about my job there, how it was, why I left. But I quit about a year ago. That way I could start working at Kaiser to kind of move forward in my career, get my foot in the door. I've worked at Kaiser for about a year, almost, next month. It's been great. It's a love-hate relationship. If you want to hear about that too, I can tell a story about my experience working at Kaiser. It definitely is interesting. My original plan was to eventually go back to school. That way I could further my career, further my education, to kind of move into a different role within the healthcare besides sonography. And I do have, unfortunately, chronic illnesses and health issues to where it affects my entire body. And unfortunately, I had to have that hard conversation with myself. And I came to the realization that it's just not going to happen. It's not something that would be physically or mentally sustainable for myself, especially when there is so many days that I do have to miss work because I'm in constant pain. My entire body hurts. And it's definitely a bittersweet thing. Today is my official last day in office. I start my new job on Monday. And it's a completely different industry, different job field. And the job itself is mostly remote, so that'll be great, especially for my body. And I'll be able to be more present with my son and my family. And it'll just be the ability to move forward and kind of get my life in a better direction for what is needed for myself. Like I said, it's definitely a bittersweet feeling. I never saw myself not being in healthcare. It'll be hard mentally a little bit in the beginning because it's a passion of mine. I've always wanted to be in healthcare since I was little, but it's what's needed, and I'm definitely really excited for this new journey.
What up, Nurse Gang? What up, TikTok? So today on Nurses in the News, Kaiser Permanente, the healthcare giant, is laying off nurses in California. Yes, Kaiser sent out 42 layoff notices to nurses working in outpatient clinics, mainly GI, OB, and mental health at San Rafael and Petaluma. They were giving the nurses 60 days. They're saying that they have about 400 open positions across the health system in California, and the nurses have time to transition into another job within their healthcare system if they want to stay with Kaiser Permanente. They said they have to make these cuts. They just do not have the funding. What are your thoughts? Let's talk about it.
Every time Kaiser comes to the national bargaining table, they walk away refusing to deal with any of the real issues. They offered a wage package that barely keeps up with inflation while they make record profits. They stonewalled us on staffing, calling patient scheduling concerns a non-starter, even though double booking and shorter appointment times directly hurt patient care. This isn't about partnership, it's about corporate greed. It's that simple. If Kaiser won't bargain in good faith, then it's up for us to fight back. And that's why we're voting yes to authorize a strike, because fair wages, safe staffing, and quality patient care aren't optional, they're essential.